Hi.
Hi, how are you?
Good. How are you doing? I'm really excited to talk with you today, and I appreciate you joining us.
No, thank you so much for this opportunity.
You're an inspiration and connecting to a lot of people that can relate with you, and you share kind of what you've been going through. Some of which is epilepsy, a two-time brain surgery survivor. So we'll talk a little bit about that. Chronic kidney stones, chronic pain, partially blind,
Yep,
aphasia.
yep.
And then you even get into other aspects of pain with the complexities that are associated with addiction and depression and mental health
Oh,
as well.
absolutely. Growing up I'm the daughter of an alcoholic and an absentee father. So I understand a lot about generational trauma. I've been in therapy for like 7 years now. I'm learning a lot. But in 2010, I would say I started performing slam poetry, which kind of took me all over the country, including I got an email from the Epilepsy Foundation of Greater Los Angeles and wound up reading for them for an opening event, which is one of the best things I've ever done to raise money for epilepsy. But I didn't develop my epilepsy until I was 23. So
Really?
and the doctors are like, there's a chance that it's been dormant. I've been suffering from migraines my entire life, but the first seizure, oh, okay, well, I guess this is a thing now. But before that, I lived a relatively never been in the hospital. Checkups at my mom, she was good. She was good on annual checkups and what have you. None of those problems. Everything, my life completely changed when I had that first seizure. I would say since I was about 16, that's the earliest I can remember. I've been getting MRIs. I like to tell people I've just been getting stuffed in tubes. I deal with my stuff with humor, that gallows humor. So, but I had been suffering from migraines for years, and but no, nothing until that first seizure. I was like, oh, okay, this is life now, and a wonderful poet that I know, Tara Hardy, had also had a similar experience, not with epilepsy, but with being able-bodied, whatever you'd like to call it, and then having a disease that took her out of life. And I had asked her if she ever thinks about her life without her disability, and she had said, "I can only think about my life with my disability now." Whereas I can remember what life was like before this. I had a neurologist who was like, I can't help you anymore. Try this doctor who was in Hackensack University Medical Center, who also did everything they could do and said, I can't help you anymore. Sent me to my doctor, who has been my epileptologist now, Dr. Stephen Karseski. And I love that man. And they had said I had gone through multiple medications, and the best and worst side effects that could happen had come from them as well. I have extremely medication resistant epilepsy. 3 to 5% of people have that. And so they had said, we're going to find out where the seizures are coming from and see if we can remove that piece of the brain. So what they had did first was an intracranial MRI. Not, I'm sorry, intracranial, MRI and EEG and all of that.
Yeah.
So they took off a piece of my skull, laid a map of leads on top of where they thought it was coming on, and then just lightly put that piece of skull back and wrapped my head up. That was the first part of it. That was 21 days that I was there like that, because they had to wait until I had a seizure, and then they were able to say, this is where it's from. After that, I had a lobectomy, partial lobectomy of my occipital lobe. They took as much as they could, but because of that, I am partially blind. And then when I was 30, I had a vagus nerve stimulator put in. There are multiple types of brain surgeries that you can have. There's one that's a hemispherectomy, where you basically separate each of the hemispheres. So if you start having a seizure, it won't continue to the other side of your brain. There are things that they've been doing for years. The vagus nerve stimulator, which is, here's one of my scars, the other is on my neck, is like a little pacemaker for my brain. It resets my brain waves every 5 years because 5 minutes, because I have partial seizures so often. My doctor, my epileptologist, he's at the forefront. And again, I live in the New York City area that is very much privileged. He is at the forefront of not just finding out what new medications can do and how they affect you, but how can we use surgical procedures to correct in the brain? Because we know so little about the brain, but there's only one way to find out, and it's to go in there and figure it out. So they're not terribly, most people who have had one, they usually had one on their side lobe, which I forget the name of right now, which is fairly easy to do. Take it out, put it back in. Mine was a mess. My epilepsy is so close to my occipital lobe, so close to the part of my brain that is vision, that they were only able to take out some of it, which is why I still have seizures. It also left me partially blind. And the way I show that people, that is, I can see my hand on the screen, but I can't see the hand. I have a right peripheral field vision cut. There's a long, like 15-letter name for it. But doctors call it pie in the sky syndrome. And that I went in and they were totally honest with me. They were honest as in, you might wake up and not have vision. And I was like, okay, yeah, here we go. All right. Go my 20s. And but I'm not gonna lie. I cried when I woke up and I was able to see my mom and my husband. And the first time I went to my first Dave Matthews show afterwards, and I looked up at the stars and I was like, you still have this. You've lost this, but you still have this. So I hold on to it. And, I have a good network of people who also know. My little sister, they grew up with me having epilepsy, as in that's all they knew. And them and my husband, I will trust to take me anywhere. They're sometimes just bouncing me off the walls because they know, okay, back into the herd. Let me guess, your vision's off. Yeah, another seizure. Give me a second. But I was on disability for 18 years. And after our last era or what have you, I was taken off of disability because apparently I don't have enough seizures per month to be considered disabled in New Jersey, which is 3. You should have 3 or more in New Jersey if you're trying to apply for a, disability. And I work retail now. So I completely went back to what I was when I was 23 and had my first seizure. I'm right back there, just not the same store. I have all kinds of them. The one that you're thinking of is what I always refer to as a Hollywood seizure, because that's what everybody knows. It's what we've been taught. And I'm going to say straight out, they're painful. Before anybody tries to say something else, yes, they're painful. It's our body is cramping up in a way we don't want it to, even if it looks normal. But I have seizures, waking seizures, about 50% of my day, partial ones, like I'm having one right now, actually, and I'm able to work through it. So excuse me if my language gets a little iffy, but the big ones, I'm lucky enough that I have an aura before it happens. So I'm able to at least get myself to the floor. The last 2 ones I had, I fell, which was not cool. And I fell at my job, super not cool. But I have almost just enough time to get to, and now it's gone. I have almost just enough time to get to the ground before it takes me out, is what I say.
But it does make you go unconscious while you're.
Some of them do. Some of them do. For the most part, I'm not unconscious, and a lot of people think that people who are having a seizure are unconscious because our vocal cords are constricting as well. So we sound like we're choking. And please don't ever put a wallet in somebody's mouth. That's not what you do. Just let them be. They're going to be fine. Okay. Don't do that. You might lose a finger, but, because my vocal cords sound like that, I've had to, for example, at my job, let them know, if I'm not turning blue, I am breathing, but I'm still here. Don't worry. I haven't had a lose conscious one in a couple of years now, and I'm very happy about that. The only 3 people that can detect it are my husband, my sister, and my best friend. I do the lip chewing a little bit, which is something a lot of epileptics say they do, the lip smacking or lip chewing. I do a little bit of the lip chewing, but it is almost always just a visual thing. And then I have another one, which I don't have anymore, thank goodness, where just my out of nowhere, no warning, no nothing, walking down the street in New York, sweet, my right leg would posture all the way up to my chest, which just does not go that far. Um, and the medication that I took to stop that is the one that may have possibly given me so many kidney stones.
Oh my!
It's a
And you have chronic kidney stones. I've passed some. Those, you want
I've
to talk
had
about
I've
pain?
had 5 in a decade. They say it's comparable to childbirth. I've never and will never have a kid, so I'm good with that. I have 5 kidney stones instead. First of all, I'm a performance poet, so of course I'm excited to be able to be like, yes.
Yeah,
So,
yeah.
no, when I was contacted, I was extremely excited to be able. And hi everybody, to
Yeah,
be able to. I started my TikTok account basically to talk about mental health and invisible illness. It's expanded to what much more as I've found friends, blah blah blah, trends. But the main part, the reason that I started it was to talk about epilepsy and mental illness, because those are two things that I don't think are spoken about,
that's right.
and they should
Yeah,
be.
yeah,
So I don't,
absolutely.
yeah, and I don't, I like to start a lot of my readings actually, or my readings about invisible illness or what have you. I'll be like, I'm not a television. I don't have episodes. I'm not a pair of pants. I don't have fits. I'm not a witch. I don't have spells. I
Yeah,
have seizures from
yeah,
epilepsy.
yeah.
Because I've said it before. I'm like, transparency is what is the best form of advocacy. Just being real about. I'm going to my doctor because I need to go to my doctor. That is the realest thing I can hear, and I'm so happy for you, and that's all I want for you. It's frustrating enough to have an invisible illness, and to sometimes, I've had it done to me personally, be invalidated by people who do have physical illnesses, or rather I should say visible illnesses,
Yeah.
and to be invalidated by them. So to get on a social media platform and say your truth and be like that, and I see people get attacked, they're faking it. Who fakes pain?
Chronic pain, just like a lot of other things in life, it doesn't discriminate. Lady Gaga has chronic pain.
Epilepsy runs everything in my life. If it wasn't for it, I wouldn't get out of the bed and take the pills. I might sleep all day. If I have to think, oh, was it wet outside? If I fall during a seizure, I don't want to scratch my legs. I have to wear pants, down to the fact that I have a vagus nerve stimulator that, there's nothing metal here now, like real metal. But at a diner, if I do this, I can take everybody's cutlery off with this. It is my life. Even if it's not for chronic illness or anything else, we're all just looking for connection. Disability is the largest group of minorities you will join at any time. To which a lot of people are like, I'm sorry, what do you mean? I'm like, well, first of all, I'm disabled. So let me see how many
Yeah.
spoons I have. But second of all, you will either get old, or your body will break, or something will happen. This is a part of my life. And if this is a part of my life, there's got to be other people who are going through it as well. Like I
Yeah.
said, my husband lives with chronic pain, and we don't play trauma Olympics in our house. I've been blessed in the fact that I've been able to write 4 books about life with it, or just life in general. But the first 2 are like really about epilepsy, chronic everything life. I'm lucky enough that it gave me that gift as well, and also that I had the time to do all of the touring. Trust me, I will ride a bus or a train for 50 hours if it gets me somewhere. I've never driven in my life. I never will, and I'm fine with that. But in the end, I'm not going to let it stop me. I might go to the mall, and although I'm not photosensitive like the way normal people are, light like mall lighting is like fluorescent lighting in general gives me hell. And I'll hop from one dark spot to another dark spot to another dark spot till we get to where we're supposed to go, but I'm still going to do it. Like, I didn't go through all the pain that I went through to just be like, nah, it's cool. Let's give up now. We're good. And also to be like, no, don't think about anybody either. Like, your life is hard. I'm sure. Forget about them. I didn't, I say that all the time. I didn't wake up from a brain surgery to decide that I was going to have a normal life anymore. And
Yeah.
it's had its all over the places. As the seizures have, with these past 3 seizures, as they've gotten worse, the pain has gotten worse. My medications cause bone density loss. So my hips, my knees. I'm a 41-year-old woman with a 61-year-old body, I think. You know, but I'm not gonna. I didn't wake up from that bed to just be like, "No, it's cool." Aphasia is basic. The most basic way to say it is you have the words in your head. You're able to speak. They just won't come out of your mouth. It's a disconnect in the parts of your. Bruce Willis actually has it right now.
Oh,
okay. He has it very severely. After my seizure, it is because they had gone so close to certain parts of my brain, and in all the testing of it as well. You can't stick a bunch of wires in there and think that it's just gonna be normal, like when you leave them. After the surgery, it was pretty bad, to the point where my husband was ordering my food for me or just pointing out whatever I needed. I have bouts of it now, and when it starts to kick in, that's usually when I know, oh, a seizure is around the bend, isn't it? Because my brain is just sending all kinds of signals, and I'm like, great. It's very frustrating for a person who writes for a living to live with. But then again, it's not as bad as it is for, say, Bruce Willis, who is now, like, his brain knows how to move his body. They're just not making the connection between the two. So it's interesting.
Yeah.
I mean, you know, it's but I love my thesaurus.com. We get along really well. And I'm really good at, when I'm writing, just leave that blank space. You'll come back to that. But it was not, I didn't expect anything like that around the bend. Definitely not. Epilepsy does aggravate depression because they ping off. Epilepsy is like, imagine your brain is supposed to go A, B, C, D, E, and your brain is like A, B, Q, F off. You know, like, it just disrupts. It'll stop for me, particularly after a seizure. I will either cry hysterically or laugh hysterically, because that's the part of my brains that have just been pinged on. But I'd like to remind people who live with epilepsy that if you had depression, your depression has probably been worsened because of the condition. I had mentioned before, my mother was an alcoholic until I was 12 or so. She was also, it was an interesting childhood. And depression came. It wasn't even a part. I didn't know I was depressed until I went for a neuropsych test before the brain surgery. And they were like, so your reading comprehension is amazing. Your language, blah, blah, blah. Your math sucks. Also, you have clinical depression. And I was like, okay, that's a thing. And it wasn't until I let it go for a little bit. And it wasn't until, like I said, 5 or 6 years ago, I had asked my brother. Now, depression and bipolarism are very rampant in my family. And I had asked my brother, I was like, how bad is it when you go to, like, the hospital? And he was like, well, if you can stand bed checks and bad food, you're fine. And I was like, you're not even going to ask me why, huh? There's no support system around here. My husband wasn't my support system, but one person cannot be your support system forever. So I took myself to intensive outpatient. I started that, I want to say, like I said, 5 or 6 years ago. Going to intensive outpatient was the first thing that I've ever done for myself, because normally I have to treat the epilepsy. What else am I going to do? I'll just die. I have to treat the kidney stones. If not, the pain, forget it. But the depression, that was me making a choice. My first therapist I didn't realize he was awful until he had said to me, well, how about you just present pretend the seizures aren't there, like you can't see them. And then I went home and I realized this guy doesn't listen to me at all. Luckily, he went on vacation, and I used another one that we had.
Yeah.
Me and my therapist, that's my bestie. And it was the best connection that I could have made.
Because you found someone that you connected with a little bit.
Exactly. We connect. I mean, he's a performer as well, which a comedian, and I made sure to create a divide between, but I was like, I need somebody who can help me know how to work, like go perform in these places that you perform in as well, where I know, for example, somebody who has committed sexual assault will be there. And what Sarah wants to do is just, how do I act like a normal person?
Yeah.
And my dog died. He got me through that, my baby. But depression is and it's generational. I've been talking to my grandmother for about the past year or so, trying to learn what her life was, because I know it's generational. And the thing about generational trauma, it makes it so hard then, because then the monsters aren't monsters anymore. They are. They've done monstrous things, but you go to yourself, oh, it's because that happened. Oh, which means you don't, that's not saying you need to forgive the person who has hurt you. It's just
Yeah.
saying it's cool to understand where it comes from. But yeah, my grandmother, I found out, was suffering from depression as well. It's run down the entire family, and the addiction as well. Both of my siblings are unfortunately addicts. I decided to get sober a little over 2 years ago, after I smashed my foot on something when we were on a boardwalk, and asked Facebook if I should go to the hospital or not. Even though my aunt, who is a nurse who works in a hospital, was like, yeah, we should go to the hospital. That's broken. And I now have a broken toe because of it. But I realized it was like 12 p.m. and I was already drunk. And I was like, that's not a way and then I realized that's my mom. That's not a way I want to live. Those are the childhood memories. I don't have any kids. I don't have to worry about that. But those were the childhood memories I have of my mom being drunk by 12. And I just, the beginning of sobriety is always stop and start. I don't care what anybody says, unless you've gone through something terrible and then you're like, I'm done. I've lost a lot of people in my sobriety, but it doesn't. At first, it bothered me, but it's the same as with your mental health journey. As you grow, or as you learn to let things go that people do use, especially as a crutch, you're not going to have those people in your life anymore. My therapist did a great job of helping me understand the difference between alone and lonely, which is one of the things that I had to do right away. And once I figured that out, I was able to let go of the people that I let go of, because I've been putting myself first. Also, I wanted to have, or I do have, the healthiest body that I can possibly have. So if I do have seizures, I get very mad at my brain because I'm doing everything you want for it. But that was a big part of it too. It was like, you know what? Let's just try and see if you're sober. If you're taking epilepsy medications, you should not be drinking alcohol. That's a first and foremost. But
Did it start to numb, kind of? It's kind of almost like a self-medicating
absolutely.
depression. You're feeling like this, and I'm feeling depressed, and when I have the alcohol, that actually helps
Or
me
rather,
feel.
for me, it was, I'm feeling depressed. I'm going to go to the bar and I'm going to get drunk, and I'm not going to remember really what happened, but assume that I had a good time until somebody tells me the story of how they had to break me out of the bathroom bar. And it's like, okay, yeah, it's time to let go. But yeah, 100% for numbing. It's
Yeah.
half for numbing, and the other half because I'm an introverted extrovert. When I do performances, like when I do shows, not that we do them anymore, I'm always the person sitting in the back of the room until they say my name and they're like, oh, that's the feature. Interesting. But once
Yeah.
I perform, I guess I kind of get the same high that from alcohol as I do from performing. Once I performed, Yeah, I'll talk to you. It's the same with alcohol. Oh, I'm drunk. I'll talk to everybody. Hey, what's up? I'm your new best friend. And
Yeah.
it also, this getting sober helped me understand even more helped me understand my mother. She was an alcoholic since she had started drinking at 11. So to deal with her, and again, generational. It's
Yeah.
just, but it's the best thing I could have done for that and therapy. I'm not gonna lie, I sometimes stay sober out of spite because I like the numbers and I like them getting the way they are and I don't want to ruin it. Sobriety is relative to everybody, so whatever you consider sobriety, if you need to get it, go ahead. If not, do you. That's how I look at it. Everybody's different. I was just unfortunately born into a family of alcoholics.
Yeah.
I do know that my father, even though they got divorced, he's Irish, but people had died on his side of the family from addiction. So I'm just hoping not. I know when the time comes, I will be everybody's obituary writer, and I've kind of written a lot already, like written theirs already.
Yeah.
So I don't want to be that. I don't want to be that. It's also very aggravating that chronic pain didn't create the addiction and everything that is going on right now. Chronic pain didn't, and people will be very fast to say it. Well, with all this and you didn't need it.
No. Yeah.
The chronic pain did not create this wave of addiction that's going on, but it's very sad that that's the only place that people feel that they can get pain. I mean, pain free. I'm sorry.
Yeah.
My mother, she is, so she's had 2 failed disectomies in her neck, and she also had she had a double mastectomy done when she found out she had cancer, and that didn't go well. My mother lives in, as I say it, if my mother was a horse, I wouldn't let her live in that much pain. And I was actually telling her today, it was very funny. I was telling her because only me and my youngest sister talked to my mom. I was like, we're not going to let you die in pain. I want you to, and I get that can be seen various ways, but what I mean is what you're hearing. We're not going to let you die in pain. When it gets to the time that it is so bad that you would rather, then I will be there with the morphine drip,
Yeah. There's an
holding the
appropriate
pump.
place for it for sure. Yeah.
Exactly. She didn't ask to be on those drugs. She didn't ask to be on those pills. She didn't ask to be, but and I was like, we will not let you die like that. Don't worry. You're not gonna, and she cried and I was like, stop crying because I have to get ready for my flight. But we'll talk in a little bit. Don't worry. But
Yeah.
my husband lives with it as well. And they're tied like all of us, our lower backs. We're basically like 70 years old. Let's create. And it's good also that we're finally understanding that trauma creates these stomach problems, these back problems, these things that we're just literally carrying the weight of trauma on ourselves, that it is breaking us down. And the fact that we're talking about it is going to, at the very least, disintegrate a little bit of that weight and make walking a little easier, is what I hope. This is why I do what I do. A lot of questions about epilepsy and surgery as well. But my Q&A is open all the time. My messages are open all the time. If I don't want your message, I'll let it go. Don't worry.
Yeah.
But I'm here for people. I mean, if
Yeah.
that's, my therapist made very sure to make sure that I know the difference between that this disease didn't make me. I am who I am. You just live with this. So I live with all these things, and all I have is advice. I'm here to give it.
Yeah. Reach out. Yeah.
Absolutely.
Fill it.
Plus,
What?
I'm really fun. This is from my book, You Must Be This Tall to Ride. All my books, by the way, have carnival themed names. And there was a great poem in every here. This is a poem about epilepsy, in case you haven't figured it out. Like I said, I've written 3 books. Come to my page if you want to check out my milkshakes. I've got published poems up there. But since we were talking about epilepsy and what have you, I think this is a really good one. It's called If I Knew Then What I Know Now. In the beginning, it was a shock and only one, and a pill. It was research and get to bed on time and no alcohol and eating breakfast and still working, but taking a pill. This is where it started. In the A&P, on the floor of the produce aisle between the cantaloupes and the bananas, your body bent backwards around the seizures. You thought to yourself, but you took the pills. This is where it starts, becomes ambulances and emergency room visits, blood draws and bruises blooming in the crook of every joint. Your first neurologist appointment, the realization you will never get your driver's license. Still, in the beginning, it is only one pill. And you thought burnt sienna. Finally, a reason for 64 Crayolas and 7 shades of red orange. You would become most pious to this burnt sienna god doled out to you twice daily. In the beginning, for 1 week, everything was perfect. This failure to report brain had a disease to point a finger at, epilepsy. So for 1 week, you swallowed the pills, and then there were no migraines, just a beautiful shimmer around everything that only now you know is a sign of a much worse battle being fought behind the eyes. Still, this was the beginning. This was a pill, and then work, and then a pill, and then the diner, and a pill, and then the movies, and a pill, and schoolwork, and a pill, and the supermarket. And then it was me on the floor of the produce aisle, choking on the smell of bananas and my own seizing vocal cords. And then, well, then it all changed.